Hey everybody, I am Jeff from CME Procedures. This is a quick tip video to help us improve how we read chest x-rays. Now as a mid-level provider, I usually have a radiologist on site that I'm going to get that expert physician that's reading my films. However, we should all know how to read a chest x-ray and at least look for the basics. So we do have a CME disc that's a little more detailed, it's more focused, it goes over a lot of the other differential diagnoses that you'll pick up with these x-rays. However, this is just a quick tip. Hey, how do we read a chest x-ray? So we are looking here at a chest x-ray. I want you guys to all take a couple seconds here and look at this image. I'll give you a few seconds and then we'll talk about it. All right, so pretty clear cut. So what do you guys think? What's your diagnosis? Is this pulmonary edema? Is this a emphysema? This is clearly a pneumonia. However, did you notice anything unusual about this x-ray? So most of you are probably saying no. So right in the middle of the x-ray, did you notice a number, a letter, anything? Okay, so in the center of this image, there is a letter or a number 5. The other thing that I want to bring to your attention is in each corner of this image, there are the numbers 1, 2, 3, and 4 in each corner, and we have the number 5 in the center. Now, why we did this is to show that our eyes are automatically drawn to our main focus, our main area of interest. We're getting a chest x-ray. What is the most common reason why we're getting a chest x-ray? Either chest pain or rule out pneumonia. So we are zoomed in, we're honed in on the heart and the lungs. However, you need to know that there is a lot of other aspects of that chest x-ray that we need to look at. So these 1, 2, 3, 4, 5 is to remind us to look at everything else. So your 1 is to remind you, look at that soft tissue. 2, look at the bones. 3, look at your diaphragm and your gastric bubble. You're going to see a little bit of the upper abdomen in some of these films. And then 4 is focus on the lungs. 5 is your heart. You want to make sure that you look at every aspect of that x-ray. Yes, we're interested in that pneumonia. However, you can miss something that could be important for that patient, such as a nodule or what could be, sometimes even a breast cancer is picked up in the soft tissue when you see a little area in the tail of Spence. So just make sure you review the whole film. This is a little simple x-ray we like to use with students just to show them they're so excited to see the film and they want to say, hey, does this person have pneumonia? Do they have pleural effusion? But they forget to look at the whole film. So, you look at the film again, you're clearly going to see the 1, 2, 3, 4 because you're going to scan the entire image. You need to build your own system on how you're going to look at all of these. I like to start with the least obvious and work into my focus point. So I start and scan the soft tissue. I then look at the bones. I look at the diaphragm, the gastric bubble, any part of the abdomen that's going to be picked up in the film. And then I go into my main focus. I'm going to scan the entire lung fields and look at the heart. This is what I do just to make sure I don't miss anything. You can use any technique that works for you. However, just do the same thing with every film, and then you're not going to be so honed in on that pneumonia that you'll miss something else. I hope this helped you. And again, we do have a CME course that's a lot more in depth, talking about chest x-rays. You can look for that online at cmeprocedures.com or find us on Facebook. Thanks a lot.